Hello, everyone. Perfect. So I'm live on Facebook as well as Instagram. Today, we're going to talk about an extremely important topic. We're going to talk about diabetes. We're going to talk about blood sugar. We will discuss why this is so very important. We will discuss why often when I see my clients in my practice, or my patients in my practice, I can see that their blood sugar is out of balance, which is going to create a lot of different symptoms for them, right? So if you are watching this live, please say a quick hi. If you are watching this as a replay, please put a hashtag as replay. If you have any questions for me at any point of time, feel free to put it in the comments and I'll make sure I get back to you. I can see Ganesh Ayurveda is here, Shri Sunrise is here as well. Perfect. So let's get started. I have lots to cover and I don't have too much time. So I'm just going to go, a little bit faster and talk about different topics that, um, with the blood sugar. So one of the things is, why do we talk about blood sugar and why is it extremely important? One thing you have to realize that glucose is the main sugar found in your blood, right? And your body is getting the glucose from the food that you eat, and it is going to be an extremely important source of energy, not just to our muscles, because we talk about muscles, right, and energy, but your blood sugar is important for all the organs. It's also extremely important for nervous system. It's also extremely important for stress response. And this is one of the reasons why, if you are completely cutting out carb and if you go on any fat diets, you end up feeling exhausted, you end up feeling not too well, right? So that is one of the reasons, and your brain requires glucose to function, right? People who try to go for a ketogenic diet is a slightly different way, because there you're getting ketones which are providing the energy for your brain. But otherwise, for most people, your sugar, glucose is the number one thing that's feeding your nervous system as well. So that is one of the reasons why it's extremely important. I'm going to say a quick hi to My Happy Home by Harsh, Amit, My Happy Story, and Cookie Mom's Molly's mom. Angela's here, Aditi is here as well. So a big hello to you, ladies. So we are discussing all about blood sugar. We're discussing all about diabetes. I have lots of stuff to cover today. So after you have eaten glucose, right? After you've eaten some kind of carbs, the carbs are going to break down into tiny molecules of glucose, and that will enter your bloodstream. And the endocrine system is, helps keep check on the blood sugar levels, right? So your pancreas will also produce a hormone called insulin, which is going to be released after a person consumes protein or carbohydrates, right? And especially carbohydrates, insulin is going to make sure it will balance it. It will open certain receptors of the cell so the glucose can actually get inside the cell and do its job of energy production and work for cellular functions. And any of the excess sugar that you are eating is going to be stored in the liver as glycogen, right? Now if you're eating more glucose than your body can handle, if you're eating a lot more glucose, or if you're not active at all, then a lot of this sugar is going to be stored in the body. And in body, certain mechanisms can convert this excess sugar into fat as well. Um, Triglycerides are, if your fat metabolism is out of balance, if you have high blood sugar, chances are a lot of this is going to be converted into triglycerides, right? And often that's why in diabetes we see a high amount of triglycerides as well. So that's the number one point. So blood sugar is extremely important for our existence, right? If your glucose supply to the brain is shut down, your brain will not be able to function. If you are completely getting off the glucose, your body is not going to function. And this happens a lot with crash diets. In my 20s, for weight loss, I did like an extremely crash diet where I was really starving myself, not eating any sugars. I eliminated fruits, I eliminated most carbs. And the result was my skin was sagging. I never had terrible skin, but at the time my skin lost all its luster. My hair started coming out in bunches. So if you are cutting carbs, be a little bit careful. Do not go overboard, right? And always, when we are talking about dietary changes or cutting out the carbs, the refined sugars or the bad sugars, pastries or refined foods like maida, all purpose flour, those can be safely cut out from the diet. But I would not cut every single thing, right? Your health will suffer because you need glucose for your brain to function. The holistic dough is here as well. Okay, perfect. So let's talk about what are some signs that you know that your blood sugar is out of whack, right? So, one thing you have to understand is your body is adapting to high sugar for a long time before you're diagnosed with diabetes, right? So, if you are eating high amounts of sugar, high amounts of refined carbs in your diet, your insulin will try to work as much as it can, right? Your body will start overproducing this insulin because it wants to bring down the excess sugars, because excess sugar is not good for you, right? So initially what ends up happening is your body tries to adapt, and after some time you either become resistant to your own insulin, and that is one of the reasons why your body is not opening those receptors. The insulin is not attaching to the receptors, it's not letting the sugar in, and that can some develop type 2 diabetes. Type 1 is more of an autoimmune condition where your cells in the pancreas which secrete insulin are dead, right? So there are two different mechanisms for two different kinds of diabetes. Type 1 is often suddenly diagnosed, right? Type 2, there is a long time that will take place. There's a lot of process that will take place before your body will suddenly give up, like will start giving up on you. So it's not going to suddenly give up, right? So there are signs and symptoms that your body is telling you that your blood sugar is out of balance. And eight main signs that your blood sugar is out of balance is, you are having constant cravings, right? So if you're constantly craving sweets, especially, or sugar, that is because you need that energy. Often when your blood sugar crashes, right, when you have imbalanced blood sugar, when you eat carbs, it's going to go high and your body will try to secrete more insulin to bring it down, and then you will have this crash, right? So when you have this crash, you are going to need something to pick you up, especially some kind of sweets. And if you're somebody who's constantly craving sugars, if you're constantly craving sweets, you have to check your blood sugar. The second sign is you're extremely hangry, right? So hangry means you're hungry and you're angry. So if you get hungry, you become irritable, you can eat the person next to you, you get really annoyed, you're extremely agitated, so that's what hangry means. And if you are constantly hangry, right, if you missed a meal, your body should be able to handle it, right? But if you get irritable extremely, it shows that your blood sugar has dropped too low and you are now, irritable because of that, right? Brain fog is another sign. So your brain cells need a lot of glucose for functioning. If it's not getting enough fuel, it is not going to function efficiently, right? So often if you haven't eaten and you suddenly start feeling foggy, you have trouble concentrating, that shows that your blood sugar is off balance. If you're waking up during the night, right, so some of the signs are that you wake up during the night because your blood sugar has gone low. So low blood sugar and high blood sugar are kind of interlinked together. You're not just going to have, like, unless you're prone to hypoglycemia, which is, somebody having low blood sugar because of other conditions, that's a different thing. But for most part, if you are on a high sugar diet, if you're on a high refined carbs diet, you will experience some crashes, you'll experience energy crashes. You might wake up in the middle of the night, right, and need some food. That's another sign that your blood sugar is out of whack. You have difficulty losing weight, right? If you're trying everything in your power and if you're still struggling with blood sugar, weight loss, inability to lose weight, if you try everything, you're doing the diet that's been prescribed to you, you're trying everything in your power, but you're just not losing the weight, it's time to take a look at your blood sugar. Chances are it's out of whack. You're getting anxious for no reason, right? If you have life situations and there's anxiety associated, that can be understood. But often with blood sugar imbalances, anxiety can be a sign where there's nothing wrong in your life right now. So that could be another sign. And fatigue is another signal. If you're constantly tired, right, then your blood sugar is often off. right? And if you're not getting enough energy in your muscles, if you're not getting enough energy in your brain cells, you will have this brain fatigue or mental fatigue as well as physical fatigue. So these are some signs that your blood sugar is out of balance. Now for diabetes, before your blood sugar can actually go off, there are some signs and symptoms that you can see, and there are early signs that you can see. From an Ayurvedic perspective, we talk about a state of high sugar where in the olden days, the flies would be attracted to you because you have a lot of sugar in the system. Or if you pee somewhere and you can see ants or other insects there, because you have high sugar, right? So those were the ancient signs how they would figure it out. Now if you have extreme hunger and if you have a lot of fatigue, right, that's a sign that could be a sign of early diabetes. Peeing more often, if you're constantly peeing, right, and if you're constantly thirsty, you're parched, you need a lot of water, right, so that's a sign that you could be having issues with blood sugar, you could be pre-diabetic. You have a dry mouth, often itchy skin is another sign, right? So dry mouth, feeling dehydrated could be a sign of pre-diabetes, as well as some sign that you could have, you could have a lot of itching of the skin because of dryness. That could also be a sign of diabetes. And the third one is the blurred vision, right? So often fluid level changes in the body could make the lenses in your eyes swell up and suddenly you're losing focus, right? And you feel you have a blurred vision, so that could be a sign of diabetes as well, or early sign of diabetes. Now when we look at the symptoms of diabetes, especially type 2 diabetes, is if you're somebody who's getting a lot of yeast infections, right, that could also be another sign of diabetes. Angela is saying that before I mentioned hair getting tangled before washing. Yes, so if your hair is constantly tangled, right, if you're always clammy, so you feel just sticky or you feel a lot of clammy, you're peeing a lot more, these are signs that you have what we call from an Ayurvedic perspective a lot of clay in the body, right? Clay, there's a lot of water that's unused, unprocessed. So if your hair is getting tangled or matted easily, that is a sign of diabetes as well. Most definitely, that is a sign. So thanks for reminding me about that. I don't think I had it in my notes for today. Um, when it comes to type 2 diabetes, so if you have had high blood sugar after a long time, you could be prone to a lot of yeast infections. Wound healing becomes a problem. So your sores or cuts in your body, any kind of wounds are not going to get healed properly. There could be numbness in your feet or numbness in your hands as well. So those could be some signs. Type 1 diabetes signs could be unplanned weight loss. So suddenly your body cannot get the energy from the food, so it starts rapidly burning the muscle and fat, right? So that happens in type 1. And you could rapidly just lose weight without any explanation. And if you're losing weight without any reason, get your blood sugar checked. um, Sometimes with type 1 there could also be diabetic ketoacidosis. Suddenly you start nauseous, and um, your body will start making a lot of ketones, but I'm not going to go too much into details, right? So these are some of the signs that your blood sugar is out of whack, and then you have diabetes as well. So how do you know that, okay, I have diabetes, or what's going on? So often there are certain risk factors, like if you have a family history of type 1, chances are you will develop type 1, right? I'm saying chances are, I'm not saying every person who has a history of type 1 or type 2 will develop. So there are family history for type 1 diabetes is having a parent, brother, sister with type 1. And like usually type 1 diabetes, which is the insulin dependent, it develops younger, right? Either you're a child or a teen or a young adult. Type 2 is the most common. People who have pre-diabetes, whose blood sugar is high for a long time, or if you are overweight, or if you are over the age of 45, if you have a family history of type 2 diabetes, if you're not physically active, right? So physical inactivity is another big cause of diabetes. And what happens is, your body consumes glucose as you work out or as you are active. But if you're just sitting like a couch potato watching TV, not really moving your body, then it is going to keep store that energy. It's not going to be able to utilize the energy, and that will show up as a higher blood sugar, right? So these are some signs of diabetes. Any questions so far? Right? So often people ask me whether diabetes is a symptom or a disease, right? So my perspective is that it is more like a symptom. It is a diagnosis for sure, right? But when it starts off as a symptom, but diabetes could develop into a lot of complications as well. And personally, this is one condition that I've seen most my life. My mom is a type 1 diabetic. My granny was a type 1 diabetic, and she had several complications related to diabetes, to the point that one of her foot was amputated and one of her knee, like her leg up till the knee, was amputated as well, right? So this was a result of uncontrolled type 1 diabetes. Often you will have issues with your kidneys, or you will have issues with your eyes. There could be visual issues later on if you don't control diabetes, right? So initially diabetes could start off as a symptom of high blood sugar. That's the only thing you see, right? And then it can become a full-fledged disease where it's going to affect all the circulation in the body. It's going to affect your end arteries. It's going to affect all the cells in your body. So it's not something that is taken to be taken lightly. So this is extremely important for you to know, that if you're somebody who's been diagnosed with like a high blood sugar, right? If your doctor says that, hey, watch out for your blood sugar, then you have to watch out for the blood sugar, right? So when it comes to blood sugar, often your doctors will ask for a fasting or a postprandial blood sugar. And now there is another test called glycosylated hemoglobin, which, or HbA1c, which checks pre-diabetes or diabetes, and it can show a 3-month control of the blood sugar, right? So it checks the amount of sugar or glucose that is bound to the hemoglobin in your red blood cells. And people who have diabetes or other conditions, like the blood sugar is going to increase, so the number of the glycosylated hemoglobin is going to increase when it comes to blood sugar, right? So different places will have different numbers, like different countries might have slightly different numbers. um, your HbA1c should be less than 6, right? Anything from 5.5 to 5.9 shows a high risk, right? 6, anything from 6 to 6.5 will again show like pre-diabetes, or higher risk for diabetes. And 6.5 or more is going to show that you're a diabetic, right? Now interestingly, a few factors to realize is the food that you eat is going to impact it, right? And eating protein might not be the only option here, because if you have a lot of inflammation in the body, right, you should be able to understand that where is the inflammation coming from. And that could create more stress on your organs, that could create more stress on your pancreas, that could create more stress in your body, and you will have higher levels of blood sugar. Emotional stress is another big factor. I'll give you an extremely interesting case study. I hosted the Ayurveda Spring Reset this year. I've hosted the Ayurveda Autumn Reset as well. But the Spring Reset was extremely interesting because I had a client who's a registered nurse herself, and she's a diabetic for over 20 years. Right. So in the Spring Reset, we changed her diet because we were eating a lower inflammatory, easy to digest diet, which was friendly for you know uh, diabetes or everything, in lowering the inflammation. So her blood sugar, which was always on the higher side, somewhere like 9 or 8, actually came down to 6 when she included more carbs in her diet, right? So often we talk about people being sensitive to carbs and the blood sugar can go high, but from eating meat and cheeses 2 or 3 times a day, she cut it completely down, and she was having a lot more grains like quinoa. She was having a lot more beans like mung beans. So we went pretty plant based for the 7 days, right? No eggs, all the animal proteins, we had taken it out, and her blood sugar stabilized, her cravings went away, right? So this is extremely important to understand, that it's not just about eating protein 24/7. It's not just about eating fat 24/7 or cutting the carbs. You have to be able to identify what's creating the blood sugar spikes or what's going on in your body. Is it related to your diet? Is it related to your stress? Is it related to your lifestyle? Or is it related to all the inflammation that you're building up in your body? Right? So normal range for diabetes too. So normal range, like again, there are going to be different readings for blood sugar fasting and postprandial, and the units are going to be slightly different according to different countries as well, right? But HbA1c, ideally you want it under 6, and there is new research coming up which says that 4.8 to 5.4 is the normal. Anything above 5.4, they're looking at it in terms of diabetes, right? India is one of the biggest diabetic capitals because I think we have a very rich diet, and people are becoming more and more sedentary now. The lifestyle is completely changing, the diet is completely changing. We are trying to go more towards like Western food, which is heavier to digest. But the country is like, the climate is not suitable for that heavy food, right? In Canada, if you eat heavy foods in the cold, your body will burn it off. In India, it's just going to stay in your belly, it's just going to stay in your body. P. Kumra is asking a really good question. Does stevia also increase sugar? No. So, stevia is a non calorie sweetener, right? I'll be discussing about sugars, sometime later. This is the first session. But when we talk about sugars and natural sugars, foods like jaggery or maple syrup or honey, they're going to increase the blood sugar. Honey, you can have it in moderation if it's pure honey. If you're buying it from the grocery store, which is like a sugary syrup or a knockoff honey, it is 100% going to increase your blood sugar. So will agave nectar, right? Stevia, monk fruit extract, there is 0 calorie sweeteners. They're not going to impact the blood sugar. At the same time, if you're constantly having stevia, if you're constantly having xylitol, which is another, non-calorie sweetener, um, it is not going to let you get rid of the cravings, right? So that is one thing you have to understand, that you also want to be able to get rid of this constant sugar cravings. Stevia is not going to spike up your blood sugar, but if you constantly keep eating sweets, you're going to keep craving those, right? Now, another question that I get asked is, can diabetes be reversed? Again, this is a very interesting question. Now, it really depends on how early you catch it and how well you manage it, right? So diabetes is not something where you're only going to be dependent on supplements or insulin or metformin. So no matter whether you're taking prescription medication, no matter if you're on insulin, you have to modify your diet, you have to modify your lifestyle, because you don't want the complications related to diabetes, right? So you don't want to feel weak, you don't want to feel fatigued, you don't want to lose muscle mass, right? So these are all, you don't want your circulation to get impacted, you don't want your vision to get impacted, you don't want your kidneys to get impacted. So that is one of the reasons why, no matter what supplements you're on, no matter what prescription drugs you're on, you have to change the diet and lifestyle, and you have to manage it. Diabetes, when it's early, right, pre-diabetes or even early diabetes, if you detect it, it becomes very easy to rebalance the blood sugar and stabilize the blood sugar, right? Type 1 can be challenging because if you have lost all the cells, if the cells are destroyed that make the insulin, you will have to take insulin injections lifelong. At the same time, I can say that I've been able to help several of my clients who were insulin dependent to cut down the dosage of the insulin by doing dietary as well as lifestyle modifications, as well as some simple herbs, right? So again, type 2 diabetes, you can easily manage it with the basis of herbs, you can easily manage it by certain supplements, you can easily manage it by diet and lifestyle modifications. But those dietary and lifestyle modifications, you will have to implement it for a long, long time, for the rest of your life, right? So I hope you enjoyed this talk today. Um, I had a lot of things to cover, and I have covered quite a bit. So I'm really happy. If you have questions for me, please feel free to post it in the comment section, and I'll make sure that I will reply. Right. So if you can just post it in the comment section, then that would be fantastic. So I can see what, I can answer any of the questions that you have. Okay, no questions so far. Perfect, no problem. Okay, thank you all for watching, and I will be back next Wednesday. Thank you so much. Thank you. I will be back next Wednesday. We are going to talk about preventing as well as managing type 2 diabetes for next Wednesday at 1 o'clock. If you are struggling with high blood sugar, if you are struggling with imbalanced blood sugar, if you have been diagnosed with diabetes, or if you're insulin dependent, if you're developing any complications of diabetes, you can set up a free 15-minute consultation with me. The link is in the talk itself. So where I've done the write up, you can set up a 15-minute call with me, and you can see how I'm helped other clients manage their blood sugar. And even if your blood sugar is high, anytime you can bring it down to balance it, you should be able to cut down the dosage of the medication. And I always work with your doctors, right? So I don't change your prescriptions. It's like out of my scope of practice in Canada, so I'm not going to change your prescription. But when we manage your diet, when you balance your blood sugar, I've been able to help somebody reduce the blood sugar levels from, a 15 down to a 7, right? But it took 3 to 4 months, and we really had to, figure out the dietary changes, lifestyle changes, manage the stress as well. Melody Singh, thank you. My husband was recently diagnosed. Thank you for watching, Melody. Thanks, Angela. Um, my talks are always at 1 p.m. on Wednesdays. Yes. Medicine, that's another good question. Herbs and medicines is what Harsha is asking me about. So there are different herbs that can be utilized for managing, diabetes. I'm going to talk about those in the next session, which will be next Wednesday at 1 p.m. Again, when it comes to Ayurvedic herbs, when it comes to Ayurvedic products, when it comes to Ayurvedic supplements, from my perspective, unless it's a food, that's fine. Certain foods, if you have it in herb form, that's totally, or certain herbs you have it in the food form, that's totally fine. But Ayurvedic herbs are not over the counter supplements, right? So I would always advise you to sit down with a practitioner. Make sure there are no other interactions with any other prescription drugs that you're taking. So I would make sure you're sitting down with someone and talking to them about the supplements rather than grabbing something over the counter, right? But for detailed type 2 diabetes, what to eat, what to avoid, we're going to discuss that in the next Wednesday's session. If you haven't liked my Facebook page, please do like my page so you will get a notification when I go live, right? So you can do that. And just if you are in Instagram and you haven't followed me, just follow me, right? So perfect. Thank you all for watching. Again, if this talk you felt some benefit from it, please make sure you share it with others as well. If you know a friend or a family member who's struggling with diabetes, what you can do is you can share this talk privately with them, or you can tag them. If they're not comfortable being tagged, you can just share this privately with them in Messenger. um, and they can see it. It's also live on my YouTube channel, so that might be an easier link to share, right? So thank you once again for watching. Have a fantastic day, and I will see you all soon next Wednesday. Till then, stay healthy and stay safe, and I will see you soon. Bye.